So guys, welcome back to TikTok. Today we'll be continuing our Physiology of Tooth Movement series. This will be our last video during this series, which will be looking at a more practical side of this topic, the clinical considerations. You wanna know why? Let's get started. The first clinical consideration that we'll taking a look is about vitamin C deficiency. Now you may be asking, how does vitamin C affect our oral cavity? And to that, I say, my friend, collagen fiber formation. Collagen fibers are formed with the help of vitamin C, and these collagen fibers are important for the development of your periodontal ligaments. And as discussed in our previous videos, periodontal ligaments has important functions. But in relation to our topic today, periodontal ligaments generally helps the tooth erupt. In patients suffering from vitamin C deficiency, the collagen fibers in the periodontal ligament are poorly developed, which can lead to late eruption or failure to erupt.
The next clinical manifestation we have are the orthodontic tooth movements. Teeth eruption and orthodontic tooth movements are analogous, except for the fact that orthodontic tooth movements are brought about by biomechanical forces. The periodontal ligament and the jaw of the bone that support the teeth have this characteristic called plasticity. Now, what does having plasticity imply? It simply means that the teeth have this ability to react positively or negatively to its immediate environment due to this characteristic of its supporting structures. Now, in a clinical setting, this plasticity and responsiveness can be utilized by an orthodontist in order to correct misaligned teeth through the use of judicious forces.
Do you remember when you're still a child and you try to bite so many hard things and your mother scolds you because of being hard-headed? That is caused by teeth problems, especially during eruption. These problems are called teething or teething issues. These common issues are faced by the children, especially during tooth eruption. When the teeth tear the gingiva and it erupts to the oral cavity, the gingiva adjacent to the newly erupted teeth shows an acute inflammatory response and pain. And the infant may also experience systemic symptoms like general malaise, diarrhea, or fever.
Have you ever thought about the sequence of eruption of the teeth in your mouth? Is it constant? Is it random? Does it vary from person to person depending on age, race, gender, or other variables? Remarkably, the sequence of human dentition is extremely consistent. However, in some cases, different classes of teeth erupt at different times. For example, a female of the same age and race experienced tooth eruption earlier than males of the same age and race. Now, teeth that appear outside the normal ranges should be considered abnormal. In a clinical setting, the teeth present in the oral cavity can be utilized by a dentist to determine the age of a patient.
We all know that the normal range of the appearance of the deciduous teeth in the oral cavity is between the ages of 6 and 6.5 months. In some very rare cases, teeth can appear in postnatal life, or sometimes teeth can be present at birth. The teeth that are closely associated with premature eruption are the predeciduous lower central incisors. Predeciduous teeth can be generally divided into two categories: natal teeth and neonatal teeth. Natal teeth are predeciduous teeth, hornified epithelial structures without the roots, present in infants even at the time of the birth. On the other hand, neonatal teeth are the teeth that erupts in the first 30 days of postnatal life. Take note that permanent teeth can also prematurely erupt due to the premature loss of deciduous teeth.
Delayed tooth eruption can be caused by many different factors. One of these factors is the presence of systemic diseases. diseases such as rickets, cretinism, and cleidocranial dysplasia. Local factors can also inhibit your tooth from erupting. You can imagine these factors as roadblocks that block the path of an erupting tooth. One such example of these local factors is the retention of your deciduous tooth, or gingival dysplasia.
Have you ever experienced heavy traffic in EDSA? It's very frustrating, right? Much like being stuck in traffic, teeth can also be stuck in the gingiva. Embedded teeth are stuck due to the lack of or inadequate amounts of eruptive forces, and impacted teeth remain unerupted due to the lack of space. A physical barrier prevents the way of eruption, such as bone or adjacent teeth. The most commonly affected teeth are the mandibular third molars, followed by the maxillary third molars, and lastly, the maxillary canines.
Think about building a house. A house can only be built on solid ground. The teeth are also similar in nature. The periodontal ligaments serve as the solid ground of the tooth. The periodontal ligaments support the teeth and also allows it to be in its functional position within the oral cavity. Once the tooth loses its periodontal ligaments, the roots can only attach to the bone. This causes a submerged tooth. It is important to note that this condition is most commonly seen affecting the deciduous mandibular second molar. This is because deciduous teeth do not exfoliate at their normal intervals, and when these teeth are located between two fully developed permanent teeth, they look submerged.
Much like a submerged tooth, an ankylosed tooth is caused by a lack of periodontal ligaments. However, the loss of periodontal ligament is due to deciduous teeth experiencing extreme trauma. The underlying developing dentition is now harmed. A dental follicle may be destroyed, and this prevents the formation of periodontal ligaments.
A deciduous tooth falling out too early can cause its successor to erupt earlier than expected. The premature loss of deciduous teeth is often caused by caries, trauma, ectopic eruption, which simply refers to a disturbance in which the tooth does not follow its usual eruption path, abnormal tooth resorption, and systemic disorders or hereditary syndromes, such as hypophosphatasia and juvenile periodontitis.
Now we're down to the last clinical consideration. Supra-erupted teeth are teeth that erupt beyond the occlusal plane due to the loss of an opposing tooth. When supra-eruption occurs, the gingival margin may follow the tooth or remain at its original level, exposing the root.
So there you have it, guys. That's the end of the video and also the end of the series discussing the physiologic movements of the teeth. We hope you learned something by watching these videos, and thank you for joining us. See you on the next one. Don't forget to hit the like button down below and consider subscribing if you're new. Also, don't forget to hit the notification bell to keep up to date on our upcoming videos. This has been Teeth Talks, signing out.